Hi everybody, Dr. Bingham here at Compass Chiropractic in Indianapolis, Indiana. So this is part 2 of the Why Does My Knee Hurt series. So the last time we talked about dorsiflexion. So dorsiflexion is that motion of the ankle that goes back. If we have limited dorsiflexion, a lot of times that can lead to knee pain. So check out that first video, especially if you've had any kind of ankle sprains. A lot of times that can lead to lack of mobility in the ankle that then travels up into the knee. Today we're going to go above the knee. Last time we were below the knee, now we're going above the knee. So we're going to talk about the hip and the effect of the hip on the knee. When we run, if we have any kind of hip instability, and this happens when we walk, we go upstairs as well, if our hip isn't doing what it's supposed to do, that's again going to put more stress on the knee. So how do we know if we're putting too much stress on the knee from hip instability? There's a really easy test called a step-down test, and I'm going to show you that next here. So this works really well if you've got, particularly like an iPhone that has slow motion video. You can have somebody take a quick video of you, and when you do this test, very important that when you step down off of here, you do it slowly, but that you also land with your heel first. So a lot of times people will just step off like this. That doesn't load the joint as much and load the hip as much, so we want to do it slower and we want to land with the heel, and I'll show you how we'll do this. So as I step down, I'm going to put the foot out, we're going to slowly come down, and then we're going to walk forward. So you'll have somebody video that for you, you'll go back and look at that video. What you're looking for in that video is you want to see your knee staying pretty much right in line with your foot. What we see often when we have hip instability, for example, so let's say this side here has hip instability. When I step down, what I'm going to see is that knee diving inward. So if I'm doing that every time I'm taking a step, every time I'm running, I'm constantly putting strain on that knee. That's going to pull on the outer side of the knee. It's also going to stretch the inside of the knee. It's going to put more strain over the meniscus. You do that enough, it's going to wear down the knee and you're going to have a repetitive stress injury. These are things you're not going to notice right away. This is more particularly if you increase your mileage, increase activity, that's when these things are going to show up. Now, the reason this happens, it can happen for a number of reasons, but the most common reason is because a muscle in the hip isn't doing its job. So there's a muscle at the very top part of the hip, it's called your glute med, and whenever you are in a one-legged stance, it's what keeps your knee tracking in the right direction. If it's not doing its job, like I said, it's going to allow that knee to dive in, and that's going to put more stress at the knee. So one of my favorite exercises for this is what's called the monster walk, and we do this with a band. And so you take this, put this around the lower leg, and one of the most important things about this exercise is we want to get some tension in the band, and then we also want to get in that athletic stance. So what that means is we're going to be down, I'd say, roughly 15-20 degrees of a bend here. So this would be if you're playing sports, you want to be in this position here. We don't want to be up here. If we're up here, we're going to be using the muscles that are more on the outside of the hip. If we're down here, we're using the muscles that are in the posterior part of the hip. So in this position, the monster walk, so the beginning part of this is walking in a slow movement pattern of going like this in that athletic position, and as we're doing this, we should start to feel some tension in those upper muscles, that glute med that sits right there at the top part of the hip. Now that's the beginning one, so you can start with this one. You can also get into doing circles. So there's a lot of other variations, but I always have people start with this one first. Now, if this is too much for you, there are other exercises like lying on your side, working on doing clams. Those are great exercises, but particularly if you're a runner, I like to give you something that's going to simulate what you're doing when you're running. And so this one being a standing exercise, I feel like activates that muscle more, and it's also more similar to what you'll be doing when you're running. So just to do a quick recap, the muscle we've been talking about, it's called your gluteus medius, sits on the top part of the hip, and it is responsible for keeping your knee tracking in the direction it's supposed to, and also preventing what we call valgus stress, but that shifting of the knee inward. And so strengthening of that muscle is going to keep you stable there, particularly in that later part of your run when muscles start to fatigue. That's when we start to see this happening a lot more. So let us know if you have any questions, and good luck with your running.